next thing we're going to talk about is an LMA, which is also called the laryngeal mask airway. This is oftentimes used in shorter surgery procedures, but in the emergency room we think of it as more of a rescue airway. It has a one tube. The end will attach to your bag valve mask, and the other end will go into the patient's airway. And then there's a balloon with an indicator to check it, that you would double check and inflate before you start your procedure. These LMAs typically hold about 20 cc's of air, so you want to make sure that there's no leaks before you place your LMA into your patient's airway. The LMA is placed in a blind technique, and I will show you on this mannequin what the LMA is meant to do. So it is meant to slide into the patient's airway, and as you inflate it, it will be held fairly securely in the airway. As you can see, the larger portion that you've inflated is meant to block off the esophagus, and the fenestrations in the LMA are meant to cover the patient's airway. That way, when you bag your patient, your oxygen will preferentially be directed towards the patient's airway and away from the esophagus. It should be noted that this is not a permanent airway and that there does still remain a risk of aspiration because this is not a perfect mechanism to block the esophagus. I'll demonstrate now in the mannequin. Again, you have your LMA, your 20 cc syringe. You open the patient's airway in the sniffing position. You place the LMA in the patient's mouth, and you slide it until it fits fairly snugly. You place your 20 cc's of air in, and then you attach your bag, valve mask, and you bag the patient. Again, it's a blind technique, and again, you should be cautious, as with the oral airway, that when you place the LMA, you don't want to push the patient's tongue back with the apparatus.